morning and welcome to Perspectives on Invicta 98.9. Today we're moving away from regular politics and of course what is happening on the stage, governance and all of that. We're moving to health, and with health, on a Tuesday like this, program is sponsored by the Kaduna State Ministry of Health, where we talk about COVID-19. It's a reality, it is still with us, and the news, around the world is that the United States, COVID-19 is taking its spikes on the United States, and of course, the dangers, we're recording deaths now in their thousands in the United States. Britain is not spared, and of course France and other European countries are not spared. Matter of fact, Australia by tomorrow will be 100 days that it had been on lockdown. And so what could the situation be with us in Nigeria and back home in Kaduna? We'll be talking about it, and of course we're talking about the safety measures that have been put in place for us to stay safe. Yes, what is coming out now and what we're getting is that people have completely or almost, let their guard down on the coronavirus, and so people are living as if it's a normal life. But the sad news is that it's not normal. Again, we're not near normal, and we must again keep educating, informing, and creating awareness here that COVID-19 is real, it is with us, and of course with America, with the data that it has, it is showing that COVID-19 is really taking its toll on the United States of America. But let's talk about it, what back home, what the government of Kaduna State is doing to keep our citizens safe. I'll be talking with Dr. Elias Neyu this morning. Is the incident manager, Kaduna State COVID response team, and of course he's a consultant public health physician and the director of family and community health services of the Kaduna Primary Health Care Board. Dr. Elias Neyu, good morning and glad to have you with us.
Good morning.
Yes.
Glad to be here.
All right. Okay, we can hear you loud and clear in the studios here. Dr. Neyu, the situation that we have, with us here, talk about at the national level and coming back to Kaduna State. What are we seeing? What are the signs showing that that we do not go back to a lockdown again?
Hello?
Dr. Eliasu?
Yes, the question again, sorry.
Yes, I was just saying that with what is happening United States and some parts of Europe, and of course just introducing too that tomorrow, Wednesday, Australia would be 100 days in lockdown. Again, we bring it back home to Nigeria. What is happening in Nigeria, and of course lockdown is what we just would not want to hear. But what are we putting in place to save us from going down on another lockdown?
So thank you, Alabi, for that background. But you would agree with me that just like you said, nobody wants lockdown anytime in Nigeria or anywhere else. So you would agree with me on that. And that's because it has a lot of effects, not just on people, in terms of getting their daily livelihood, getting their daily bread. It also affects the country in terms of what it brings in as internal revenue, and even other services you won't be able to get them optimum. People are farmers, they may not be able to go to their farms. People are marketers, they won't be able to buy and sell. So nobody wants to go to lockdown. And because of this, the government of Kaduna has always begged, has always asked citizens to be responsible. And when I say responsible, what I mean is that we should take those safety measures more seriously, so that we don't have to face what we faced some time back when we were in lockdown. And for that reason, it's a concern that when you move around, you see people are just being careless with all these safety measures that have been put in place. Really, if you go out, you see that people move around without face masks. People move around without observing social distancing. People move around without bothering to do the frequent hand washing. And you find out that where they have made provisions for hand washing, you may even find out that the container doesn't have water, or the water is there and there is no soap, and nobody bothers to even raise an alarm that there is no soap to use in the. So it's just disheartening. People even move around saying that Corona is over. That is why schools are opening. That is why markets are opening. But all these are not true. You know, it's not over. We still have to put those strict measures in place. We still have to agree to take responsibility and make sure that we protect ourselves and also protect our loved ones from having this infection. Because this infection, like we know, has made a lot of people lose their lives. In Kaduna State, yesterday we had another death, so we have 43 deaths in the incident case in Kaduna State. And that is not funny. Prominent people have lost their lives even in Kaduna State from this disease. So it's not rich people have lost their lives, poor people have lost their lives from this disease. So it's a disease that is no respecter of age, is no respecter of sex, even though some have higher predilection, but still we have lost people across all strata of age groups. We have lost people across both sexes, whether male or female. We've lost people with different health background, health status. So there's no saying that I am immune, because that is not true. There's no saying that even if you touch me, I'll survive. You cannot know for sure who will survive and who will not. So you have to put, even if you will survive, if you give it to somebody else that is your loved one, how are you sure that person survives, will survive the infection? So this is a cascade which we have to break the chain. And to break the chain is to keep yourself safe, and by keeping yourself safe, you are protecting others also from the disease. So it's very, very disheartening that most of us are throwing the precautionary measures to the wind and just doing as if our lives is just ours. This disease does not exist and it's just a propaganda. If it is in Nigeria that we are already going into a second lockdown now, they will have politicized it. But you can see not even in Nigeria, even countries that have good healthcare system, better healthcare system, are even going, because they are having the open up for schools, they open up for other businesses, they are already having another spike. And because of this spike, they have to go to another lockdown so that they set the clock backward and have fewer cases and put in measures again to going forward. So I use this opportunity and ask all of us to be responsible and protect ourselves, and even preach the word to others to also protect themselves by doing these simple measures. Wash your hands frequently, as much as possible, and wash it properly, 20 to 40 seconds. Put face mask when you are leaving your house. Don't forget that, and avoid large gatherings. If you are in a large gathering, remember that you are more likely to reach that distance where you will take social distancing that we talk about, which is 2 meters minimum. So all these have been, and even Kaduna State have even gone on to put in what we call the flood campaign, if you remember. I think before it runs out, or we run down through the fourth campaign again, so that people would know that the government is serious. We are putting everything that we should put in place, and we should respect all this and make sure that everybody is safe.
All right, Dr. Ilyasu, we went through some traumatic, traumatic, as to put it that way. The young ones, the youths of Nigeria came out, in their thousands all over the country to protest, and their protest was on End SARS, the hashtag End SARS protest, and we saw, in their thousands, and of course all the protocols were let off. We saw hugging and no space thing, and of course all that could have happened on that day. Then again, what followed with the palliatives, again, young men and women, again, in the thousands trooping out too, on these unfortunate days where they were, out for palliatives, and of course we saw them in their thousands too. Your thoughts about staying safe with COVID-19, with what we saw with the NSAS movement, protest, so to say, and palliatives, carting away, palliatives that had been put in store.
So this is an unfortunate event that happened the last few 1-2 weeks, and it's just regrettable. It's regrettable because we lost a lot of lives. Young men, youth lost their lives, and it's regrettable that their life has had to be shortened like that due to a protest. But much as I would say, well, everybody has his own opinion. The youth have their own opinion. The timing, I wouldn't say it's right, because we are just easing down some of these lockdown measures with the hope that if schools would even resume. Kaduna have already said that we should put in a mechanism in place. We should have a plan for different sectors of education to be opening every 2 weeks. And with this recent happening, you would agree with me that all these have been set back with some milestones, because now the youth protested without taking all those precautions. All those precautionary measures were not observed. Youths were moving in drones. They were moving as a crowd without any mask on. They were singing, talking to each other closely. So we were using what do you call it now, megaphone. You use it, you pass to the other, he uses it, you pass to the other without any washing of hands, use of sanitizer. So it's just a recipe that will end up at nothing else but having spike of cases, like we've seen in other countries. And even in Zaria, the burial of the late Enya, may so rest in peace, gathered a lot of crowd, and even when we did a case stats in Zaria and Sabongari, it actually showed that those gatherings led to an increase in the number of cases in which we saw in Zaria and Sabongari local government of the state. So that protest, I feel it was ill-timed, and it will lead to nothing else but more cases. Then, this issue of palliative came around, which is another incident that people were gathered together, were moving in drones, moving as a crowd, just leave the destructions and looting and everything apart. But the health risk that was observed, it's also disheartening. It's just too much. No face mask, social distancing was not observed, all the precautionary measures were not in place. Youths were just doing their business, people were just doing their business. That is something that I'm sure we will see the effect of this in the nearest future. In the nearest future, just a pity. So things continue like this. It just looks like Nigeria is actually heading in the right direction for another lockdown. Yes, lockdown either from the COVID-19 or lockdown from curfew. We experienced 24-hour curfew recently, and as I speak today, I think 2 local governments here are under 24-hour curfew, which is like another lockdown. Chuku local government, Kaduna local government are still observing the 24-hour curfew, while others have restricted time to move about. So we are just moving in the right direction for another lockdown, and that's just unfortunate.
Well, let's be looking at the testing centers in Kaduna State. We do know that there are testing centers, and facilities where patients, those positive with COVID-19, can go to. But again, with what is coming up now, are we talking about? Should we be in any way envisaging a situation where these centers might just be people coming in now might just overwhelm the facilities? Are we looking at that?
So unfortunately, I don't think that will be the case, because people don't like to go and get tested, even if when they have symptoms. Some are enlightened enough to go. Some are just scared of the unknown. They prefer whatever it is, even if it's COVID, let it come, not minding the fact that they are putting other people at risk of being infected. So if people don't offer themselves to be tested, don't think that I should be tested because I have exposed myself to risk, then we won't see that overwhelming situation which you spoke about. So, but if people will take responsibility and go and get tested, we may have a situation where the laboratories will have a full hand in terms of coping with the number of tests that are coming in. But our capacity to test is quite high in Kaduna State, and we have the capacity to test over 500 samples in a day, using our 4 designated laboratories in Kaduna Zaria, and we are even opening some, still putting some logistics in place to see that we open in Lure, we open in Kapanchan, and also in Kacha local government. So that process is ongoing. We are having some challenge with logistics, movement of equipment and all that, and movement of commodities and consumables. But we will get there. The governor is determined to ensure that he will put everything in place, everything that we need to diagnose and also to manage patients. And then it will be the responsibility of people, of community, to put their hands together and come together and have people that have symptoms go for tests. And when people are tested, if they are possible, the support of the person being tested, the support of the community, the traditional and religious leaders is also needed to ensure that these people that are positive get all the care that is necessary, all the care that they need in the treatment facility.
Yeah, Dr. Elias, you talked about responsibility, that we all have to be responsible now. Is there in any way saying that, again, we must be on the alert and watch out for, even our neighbors, that some ailments that could come, they could go down with, whether malaria or whatever, could be suspicious, especially now that the spike is on again, moving on.
So that responsibility, I'll put it in 3 different aspects. So the first one is that when you have symptoms, whether fever, whether whether severe headache, with loss of smell, any of that, you should go and get tested. We have made sure that there are sample collection centers in general hospitals, in our secondary health facilities. You could walk there and get your sample taken, and the samples will be transported to the labs for them to be analyzed. So that is when we have to take responsibility when we have symptoms. We go and get tested. We also have to take responsibility to give the message to people, to the community, that there are risk factors. And when you have any of the symptoms, go and get tested. So you as an individual, you have symptoms, go and get tested. People also have to take responsibility and give information out and ensure that people know about where to be tested. And when you have symptoms, you don't just sit with your symptoms doing self-medication. Go and get tested, and if you are positive, you get the treatments that you require. And the other one, the last taking responsibility, the third one, which I want to bring to us, like I said, is the issue of the preventive measures. If you remember, I mentioned fraud campaigns in our last meeting with you. I tried to explain what the fraud campaign is about, which the government of Kaduna State have carefully articulated to ensure that people remember these safety measures. And the opportunity is not just to remember, you have to comply. So forward is spelled SORWARD, and each of these words has meaning. And using this meaning, we remember those safety measures, like the F is for the face mask. Face mask is our shield. Stop the spread. Wear a mask always. So whenever you are leaving your house, for whatever reason, put on your mask and move. The O is to observe. And what are we observing? We are observing the social distancing, which is a minimum of 2 meters or 6 feet to stop the spread. So observe, keep 6 feet physical distancing, stop the spread. So that is taking responsibility in the flood campaign. So that's the O, and we have the R, which is respiratory hygiene. Don't forget, you may have to once in a while sneeze for whatever reason or cough for whatever reason. And if you are going to do that, you observe the respiratory hygiene. Use a tissue paper, cough into it, and dispose of it safely into a bin, a covered bin. And where you don't have tissue paper ready available when you want to cough or sneeze, what you need to do is not to use your hand, but use your elbow, your bent elbow, and then you cough into it or sneeze into it, because that part of the body doesn't come in contact with other people. You find that people sometimes touch other people, whether unconsciously or consciously. Sometimes people shake hands unconsciously, which we are discouraging. Sometimes you carry your hands to your face, you scratch and itch in your face. Some even put their hands in their nose and ears, for whatever reason, and that is something that can spread the virus. If you get it somewhere, you can bring it to your face, and then if you touch a surface that the virus has landed, you can bring it to your face and you can get infected. So the R is respiratory hygiene, cough into a tissue or the bent elbow. Then you have W, which is to wash your hands with soap and running water. And if that is not available, then we use sanitizer to kill the virus and prevent the disease, if the hand sanitizer is the one that is available. The preference is for washing of hands. We have the A, which is avoid large gatherings. Stay safe, stay at home. When you avoid large gatherings, that means you are less likely to come in contact with people that have the disease, or come in contact with people that will not be observing the physical distancing. Don't forget that 80% of people that have this disease may not show even any sign of symptoms. So if that is the case, If you avoid large gatherings, that means you are avoiding the likelihood of coming in contact with somebody that has this virus. And then the R in third is to remain indoors. You can do other exercises and other things to keep you healthy and occupied at home. So remain indoors unless you really have to go out. And the last of the deal is diet. You eat well. Vegetables, fruits, which will help in boosting your immunity and keeping you healthy. So the fall campaign is not just about even the coronavirus. It helps you in general to be healthy. So you can see talking about remaining indoors and the exercising, and also talking about good diets that will help to boost your immunity. So these three aspects of, if you have symptoms, take responsibility, go and get tested. We should spread the gospel of coronavirus disease and its preventive measures. And then the last, which is the third campaign, which the government of Kaduna has carefully articulated, we should observe the various components of the third campaign. So these are responsibilities which the government cannot do for us. We can only do that for ourselves. So that's the situation.
Okay, Doctor, we'll have to go for a commercial break, and I hope to join you after this break. Quickly, to our listeners out there, today is Tuesday. It is set aside by the Kaduna State Ministry of Health to talk about COVID-19, the reality of it, and to tell listener that COVID-19 is real, is still with us, and we must do all that we can to keep ourselves safe. And what Dr. Elias Uneyu, the Incident Manager, Kaduna State COVID-19 Response, Consultant Public Health Physician, Director of Family and Community Health Services, Kaduna Primary Health Care Board. What he's been doing all along is to tell us that COVID-19 or coronavirus is real and still with us. And so we must, keep ourselves safe. And there are measures that have been put in place to keep us safe. These measures have to be taken seriously. This program this morning is brought to you by Kaduna State Ministry of Health. We'll go for a commercial break. Be back shortly. Victor FM. Welcome back. It's the program Perspectives this morning, and this program is sponsored by the Kaduna State Ministry of Health. It's a program that is dedicated to creating awareness and, of course, informing on COVID-19, the reality of it, and that's why we're doing this. And my guest this morning is Dr. Elias Uneyu, Incident Manager, Kaduna State COVID-19 Response, and of course a consultant public health physician and Director of Family and Community Health Services, Kaduna State Primary Health Care Board. Doctor, this is pertinent for me to ask this question, and of course because of where we might be having another upsurge, and that's talking about reopening of schools. For some states, schools are reopened, and of course primary, secondary, and we might just be going to tertiary institutions. And like we've said, when COVID-19 came about, it exposed our health sector and of course other sectors of the society. And one of the areas it showed to us was that boarding system or hostels system in the schools for now is not the best of it for high institutions, where in a room you could have about 10 students in the room, and that what we'll have to do to take care of the students. We also know about the students too. They can be mischievous, so to say, but whether the school authority puts in some measures to make the students safe, the students can go back and to these rooms, all to avoid paying for hostels. And then we talk about school activities, sporting activities that must take place in our schools. All of these will have to come and play out now. And we are talking about getting our schools reopened. Are you worried and concerned that for this teeming youth, again, what dangers lies ahead? Of course, talking about spikes in COVID-19 here.
So that is a concern for everybody. I think most as people are concerned, at least anybody responsible will be concerned about schools reopening and what might happen. So that is why even the government has said that no school should be opened unless it has put some measures which Ministry of Health with guidance from Ministry of Education with guidance from Ministry of Health have already agreed upon. So some of those measures are not different from what I've mentioned earlier, but issues of hand washing at every point where there will be gathering, whether it's lecture and all that, it has been agreed that they will have all these hand washing or hand sanitizing equipment there. Before you even enter the school, yes, you should have all those hand washing and hand sanitizers at the gate before you even enter. And the other measure which the education sectors have made sure that it's one of their guiding principles to protect against the infection is that as you move in the school, before you even enter, you have your face mask on. So one of the peculiar things about school is that they have gathering in class. It's usually not one person. You have a lot of people in class. But you agree with me, if you have seen the protocol for school, that they have agreed to reduce the number of people that teach in the class in the same time, even if it means reducing the hours for school period and having two different sessions. People that do only from morning to evening will now start doing morning to afternoon, and then some will start from afternoon to evening, and all this is to ensure that safe distancing is maintained in among students. And you also mentioned something on in the student accommodation.
Yes.
So that's why we said people have to take responsibility. We cannot force. I don't know if in hostels you can actually force the number of people that will stay in a hostel. But when it comes to people that stay off campus, that again will come to challenge. You cannot say people that stay off must stay so number per room. So that again is something that people have to take responsibility and ensure that they do the protective measures as best as they could. So we may not have the answers for every situation or every scenario, but if people understand what it means to protect yourself, and by protecting yourself, you are also protecting others, then it wouldn't be an issue. But if we throw caution to the wind and act like nothing is happening, then even the schools that have opened, we may find ourselves closing down again. And that will be too bad, that will be sad. Because right now, the education sector is one of the sectors that has been rough affected. Where students have been home for how long now? 7 months or even more? So I'm just hoping that we'll take responsibility, we'll give all the necessary cooperation that is required and ensure that we, as we are protecting ourselves, what it means is that we are also protecting others.
Okay, Doctor, quickly, because I have to get my lines open now. Government wants her citizens to be safe, and it also behoves on citizens too to do all they can to stay safe. And so all the protocols, that we must observe these protocols or measures put in place for us to stay safe. One issue here that stands out is on compliance. Even with what you have said about having our schools opened, and of course on transportation system, market, what happens there, compliance is also needed for on the protocols that have been put in place. Are we seeing, the best, or the best of compliance in all of these measures that have been put in place, or is just lip service that we're paying on compliance?
Sorry, I know compliance is the magic word. All these things will not, no measure can be 100% effective if we don't comply to not just one of the components in terms of safety measures, but all the components. Compliance is the magic word, really. Is a silver bullet in this case. But I don't know, did you ask any questions specifically on that?
Yes, I am talking about even if you do have our schools opened and have these hand sanitizers and all of that in place, for how long, would these schools, keep that, maintain that? And this is where again I'm talking about compliance. That's how we have to keep it going, or stay on with compliance.
So I think compliance should go on as long as it is necessary. The truth is the new normal for us is for us to always be keeping all these safety measures in place. So that will be the new normal for us. What I'm trying to say is that we may not in the nearest future have COVID-19 eliminated. We may not in the nearest future say we don't have cases of COVID-19. And as long as we have cases, for as long as we have cases, that issue of compliance will always be there. We need people to be compliant so that they can protect themselves. If we are not compliant, if people are not compliant, then we will have spikes. We will have people missing out in their business. We will have people getting sick. We will have people being admitted. We will have people losing their life as a result of carelessness, not compliance with safety measures, which are simple, which we should make to be like our life, how we live our life. So this is all about behavioral change. It's a behavioral change strategy, and nobody can force anyone to change behavior unless you yourself you take responsibility and you want to be compliant. So you have to make efforts to be compliant. It may not be a simple measure, but it may not come easy like that. So as long as we have coronavirus disease, we would need everybody.
Okay, and Dr. Neyu, the world is still waiting for the vaccine on COVID-19. We're still waiting. Yes, and testings are still going on. But again, let's talk, come back home where, we all, are coming out from one society or the other where, herbal treatment is part of, what we introduce or what we've introduced into our health system, that with herbs can do a lot. And a lot of people still go home with this thing that yes, there are herbs that one can use to stay safe. Again, we have had people who have tested positive and of course have been again treated and are back into the community. And one thing that people do not know is what were the things, the medicines that were used to get them treated, so and they're back safe with us now. Is there something that is available for all to say, yes, if you have symptoms or you're coming down with COVID-19, these are things that you could use?
Okay, so you mentioned something about vaccine, right?
Yes, that the world is still waiting for the vaccine, right? Yes.
Yeah. So nobody can say categorically this is when that vaccine can be in Nigeria. Nobody can even say categorically if that vaccine will be available in Nigeria. Countries are even paying in advance for these vaccines, when once they are developed. We have already, countries are even procuring, trying to procure in millions. And even the manufacturers, so far as I know, they have already owned up to that they may not be able to cope with the demand. And some countries are richer than other countries. So if one country gives all the money that is required to procure it, are they to sell to that country? So there are even protocols in which they want to distribute these vaccines when they are available, because they are not available in the quantity that is, it will not be available in the nearest future in quantities which we should have. So that is one of the issues. So for vaccine, we'll keep our fingers crossed for now. The other thing about health, things people can take once they suspect, there's a standard protocol. There's no confusion on. There's no confusion in terms of the protocol for COVID-19. Once you have symptoms, get tested, and once you test and you are positive, you should be in a treatment center, in an isolation center, where you get all the required care that is necessary. So I think the protocol is straightforward. There's nothing like if you have symptoms, you should take 1, 2, or 3 while at home. Get tested. Once you suspect that you are, even when you suspect you are in contact with somebody that has the infection and you are not sure, you should seek the health advice, get tested, and you go from there. So there is no protocol, there is no guideline on other stuff in which you take, but what we have as a guideline is, if you remember the G in the fall campaign, which is diet, we should have good diet, and I mentioned fruits and I mentioned vegetables.
Okay, Doctor, let's get our lines open now. Numbers to call to be part of it this morning: 081 40,000 989 or 070-87-800-989, 081 40,000 989 or 070-87-800-989. Let's get to hear what's happening in your neighborhood and what are your concerns out there too. Okay, let's get to hear you, and then we pass it on to Dr. Elias Uneyu. Hello, good morning.
Good morning, Mr. Toya Levy.
Good morning.
Good morning, Doctor. My name is Musa Bella.
Yes.
Yes, let me quickly start by still thanking the Kaduna State government and any other government that make it consistent on the sensitization of the effect of COVID-19 and how to go about it. In my community, the directive given to schools to resume, they have resumed and they have observed the protocols on the school resumption. And even our contact within the community, we adhere to strictly. But if going by what we always hear, the unfortunate looting of the palliative shows that there's no any physical distance within the people that have participated in that unfortunate act. And no matter how anyone justifies the looting of palliative meant for COVID-19, it shows that the immediate community that have looted that items deprive other people from other local government also to have some of these palliative. So we cannot justify that, and we have violated one of the basic protocol of reducing COVID-19 because the association there is so unfortunate, absolutely unfortunate. And I'm calling on the Kaduna State government not to relent, not to allow the activities of few made them to relent in the sensitization. At least we have seen the distribution of the palliative the first time, the second time, and the third one that was about to be distributed was the one that was destroyed and looted by some people. And no matter how you try to justify it, it's absolutely unjustifiable. Good morning.
Thank you, Musa Bala. All right, stay with your calls.
So I didn't get what Musa Bala was saying.
Well, he was talking about his community, that schools are opened, partially opened, and the community are staying with the protocols. So that's good news, I guess, yeah. And another call here. Hello, good morning. Good morning.
Good morning, Mr. Chairman.
Good morning.
Good morning to the doctor. You're answering Engineer Manuel.
Yes.
Like in my own community, I think the school have not yet opened because the things to put in place have not been in place. That is in Bagodo, to be precise. I think the government or the local government needs to look into that aspect so that the protocol of COVID-19 will be followed to the latter. But some things I observed on this issue of COVID-19, because there is a threat, maybe there may be another lockdown because people are not held to the COVID-19 protocol. Even the elite, Mr. Chongalabi, if we must tell ourselves the truth, when you see the elite, the way they engage, there is no social distance in their engagement. They come close and do whatever they want to do, and they went away. Now, the question I want to ask the doctor, now what are we expecting with the recent development across the country? Because the COVID-19 agency, disease control agency, was telling us that with all this new development, now the tests have been reduced. Now I don't know what we may be expecting after all these things that is happening. What are we expecting, and what are the measures will the government put in place to see that this thing did not escalate beyond how we will be able to manage it? Because we have that some countries now are doing under lockdown because of the COVID-19 has gone headwire. So please, I think leadership with example. If we are talking about social distance, the leaders themselves should live by example. Then the followers also will live by example. But let him tell me this morning, what are we expecting with all these things that is going around? What are we expecting concerning the COVID-19?
Okay, Emmanuel. Let me just take in one more and then squeeze it. We'll pass it on to the doctor. Hello, good morning.
Good morning, Mr. Sayala.
Good morning.
Chief Amote Kobulu Bandeman.
Okay, Amote.
Good morning, Mr. Doctor. Mr. Sayala,
yes.
Let us tell ourselves the truth and let us call a spade a spade. Now, the governor's forum yesterday, I hope you are a journalist. Did you take the record of the governor's forum yesterday? Did they need social distance and at their office? The answer is no. As your engineering business, leaders by example. After they do their meeting of the way they are healing us, telling us how they take keep the food for local stores and the warehouses, now they according to what the doctor said. Let me also ask doctor, I have not a time asking one question and he refused to answer me. Now they say give us palliative, and the doctor clarified it last time that the palliative has been shared. Now we see those palliative with the capital letter COVID-19 palliative being filled inside warehouses. Now the Nigerians are taking it since they refuse to put it to them. Now government are calling them looters, all sorts of things. Are we going to?
I am sure that we have had government officials, who have come to explain. If you're listening to me, we've had government officials here in the studios who have come to explain. Let me just get through with that. We have explained what the palliatives, and then we also had the Commissioner of Internal Security and Home Affairs here yesterday, who had also made his own position from government side. And this is to inform you that we're hoping to bring in the Commissioner of Budget and Planning, who was directly involved, and some people would say even accused of, hoarding of this palliative. So we'll come to that. But for now, what we're doing here is keeping ourselves safe, as Dr. Elias Tuneyu is explaining to us. Doctor, please take over. Dr. Elias.
Oh yeah, sorry, Alabi, I got distracted with somebody I was talking to.
Yes.
So can I have the questions again?
Yes, and we're just about to round up. Just give us your last line here.
Okay.
What to go home with? Yes.
Oh, what to go home with?
Yes, as talk to us as citizens too.
Okay, so thank you very much for this program. I'm sure it's very enlightening even to me. I find it interesting how people are thinking and what they are expecting. So what I want to say right now is that please, we should be responsible. preventive measures, we should take them and follow them. We shouldn't be looking at somebody else. Somebody said leaders should lead by example. Totally agree with him. But if the leaders are not leading by example, that should not be a deterrent for us to do what is right. Okay. We show the leaders what is right. Let them also learn from us.
Okay.
So that's all I have to say for now.
All right, Dr.
So everyone.
Okay.
And have a good day.
Thank you very much, Dr. Elias Suneyu. Glad to have you on the program. And that will just be about the size of it on the program Perspectives this morning. A program sponsored by Kaduna State Ministry of Health, where we had Dr. Elias Suneyu, Incident Manager, Kaduna State COVID-19 Response Team. He is also a consultant, public health physician, a director, Family and Community Health Services, Kaduna Primary Health Care Board. He's been our guest this morning. And the message is out and clear that please keep yourselves safe and let's comply with measures that have been put in place to make us all safe. Dashen, thank you for connecting. And Wisdom, thank you for putting us in the pictures. We'll come back with Perspectives tomorrow. Good morning.